Bowel changes in older adults. Recommended exercises to prevent constipation by physiotherapist. Insufficient vision, low exercise endurance, and chronic pain conditions are common in older adults. These make them adopt a sedentary lifestyle. This may inhibit the bowel movement that leads to constipation. A lot of studies have shown that prolonged sitting, or bed rest, are a major cause for constipation in older adults. Exercise facilitates faster bowel movements. This decreases the amount of water from the stool being absorbed by the large intestine. What are the good exercises for constipation? Based on the human anatomy of the large intestines, the direction of descending colon and anus are facing downwards. Therefore, simply sitting up from lying position, or getting up from sitting position, and moving the gravity force can help pulling of stool down to anus. In recent years, vibration therapy has been used by physicians and physiotherapists for treating or retarding the progress of osteoporosis in older adults. Apart from its use on osteoporosis, study, Wu et al. 2012, has shown whole body vibration, using the parameter of 2 mm in amplitude, at a frequency of 12 Hz, significantly reduce the total constipation severity. Therefore, it has been proposed that older adults should have a regular walking plan, says 10 to 15 minutes, 2 to 3 times per day, can help the body bowel movement. Of course, if exercise tolerance and physical ability allow, fasting walking and jogging are even better. Simple standing, with rhythmic alternate stepping exercise. For those older adults with arthritis, or difficulty for walking, a simple standing with rhythmic alternate stepping exercise, for few minutes can improve bowel movement. Abdominal wall, muscle training. Some studies have shown that a 6 weeks intervention of abdominal muscle training, in combination of breathing exercises, could increase the frequency of bowel movements and defecation frequency than that of the medication group. Abdominal exercises increase the pressure within the abdomen. This can be helpful to stimulate a bowel movement. In real practice, older adult can firstly sits upright and then gradually leans the trunk forward, and at the same time, contracts the abdominal muscles, making the back curving backward. At this forward leaning, slump position, the older adult should breathe in slowly, and hold the breath for 3 to 5 seconds, and at the same time, pressing the tummy toward the anus, and urging to pass stool. If the older adult's abdominal muscle is too weak, physiotherapists commonly recommend them to use electrical stimulator to strengthen up the abdominal muscles as shown. Passive hip and knee flexion exercise. For older adults who are bedbound. Apart from abdominal massage, passive hip and knee flexion exercise may help press the abdomen, so increasing the abdominal pressure of older adult, thus facilitating bowel opening. To perform this exercise, operator passively bends one of the legs and brings it towards the chest until the knee is touching the chest. Hold this position for 15 to 30 seconds, and then release the leg and return to the starting position. Now, repeat the same procedure with the opposite leg. Repeat the above passive limb exercise for 5 to 10 times. Pelvic floor muscle training exercise. Due to degeneration of neuromuscular system in aging, some older adults may have difficulty to coordinate pelvic floor muscles, or anal sphincter muscles, during defecation. As a result, they may feel incomplete evacuation. Pelvic floor muscles are located inside the pelvic girdle to support the bladder, neck, and urethra. Weakening in these muscles may also lead to urinary stress incontinence, especially in some older ladies. Controlled study on pelvic floor exercises for stress incontinence demonstrated that about 85% of the women in the treatment group felt that their incontinence had improved. Older adults can do the following training to strengthen the muscles in the front of the pelvic cavity, which can not only improve or prevent stress urinary incontinence, but also train the muscles related to defecation.
咁呢啲做嘅時候好簡單啫。頭先我將兩個大髀咧夾埋一齊，係啦，跟住咧就做引尿嗰個動作，係啦，同一時間就收上去盆底部 hold 住1、2、3，然後放鬆，係啦，跟住我哋就前下夾埋，好做引尿嗰個動作 ，hold 住1。